Diabetes drugs have become increasingly popular because of their weight loss effects, and the products are flying off the shelves. But that's leaving many diabetics searching high and low for their medication. The woman you're about to meet has been waiting for more than a month now, and it's taking a toll on her body.
Turn it all the way up.
It's been 5 weeks since Geraldine Glass has had her diabetes medication Victoza. She says the effect of not having the drug has left her body fatigued and in pain. Her blood sugar is currently over 200.
It's supposed to be between 80 and 120. So I can't get the medication that I need.
Last month, Ms. Glass says her pharmacy told her that Victoza was on back order. The 81-year-old Southside woman says she called her insurance company to try to get the medication delivered, but was told there was a nationwide shortage because people across the country were using it to lose weight.
There's nothing wrong with you losing weight, but let us live. We should be the first one to get the medication.
Glass is among many diabetics across the country who are anxiously waiting for their medications. This as the demand for these types of drugs continues to skyrocket. Dr. Laura Zimmerman, chief of general internal medicine at Rush University Medical Center, says policymakers and pharmaceutical manufacturers should prioritize people who need these meds to live.
We worry short term about things like, the patient's quality of life. They don't feel good. They can't function at their top level. We worry about complications like eye disease, kidney disease, heart disease. The cumulative effect of uncontrolled diabetes can be devastating.
Dr. Zimmerman says switching to a different diabetes medication is not an easy task.
Most insurance companies cover one type of GLP-1 agonist, and the process of getting a second approved for a given patient can be very cumbersome, and it's time consuming. It places a huge burden on our clinical teams. So instead of actually taking care of patients, we're spending time doing the prior authorization paperwork, the medical necessity paperwork to get the alternative medication, which is a huge drain on our system.
She says patients like Ms. Glass may have to call around to different pharmacies to see if their medication is in stock. I reached out to Ms. Glass's pharmacy, Walgreens, and a spokesperson responded, saying in part, quote, Walgreens is always working with suppliers and distribution partners in an effort to help meet patient demand and advise patients and customers to call their local Walgreens pharmacy to inquire about availability. Any additional questions about supply should be directed to the manufacturers. In the meantime, Ms. Glass is speaking up for others with diabetes who she says should be first in line for these medications.
Think about us. We need it for survival, to live.
Some good news, though. After we reached out to Walgreens, Ms. Glass says she got a call saying they had the medication in stock at a smaller quantity, so that'll at least help her get by. The maker of Victoza, which also owns Ozempic and Wegovy, tells the I-Team the situation is unfortunate and that the limited supply situation will continue throughout 2024. They cannot project when they will reach full supply, but encourage patients to try other local pharmacies and to speak with your healthcare provider to determine the best course of action. Samantha Chapman, ABC 7 Eyewitness News.
Watch breaking news on YouTube. Subscribe to ABC 7 Chicago Eyewitness News.